Thank you again, Dr. Grier, for agreeing to have a conversation with us today surrounding all things eConsult. We really appreciate you taking the time to share your experiences so that not only our Southeast providers, but providers across the province can enjoy and learn from this as well. Before we get started, however, I just want to share a little bit about your eConsult experience thus far with the program. So, from what we can tell in our records with OTN and the Center of Excellence, you joined the service in 2017 and have been actively using it ever since. Since you started, you've sent a grand total of 431 e-consults, which is fabulous. Great leveraging of the service and the tool for yourself in practice. But the number that really caught our attention was for the past fiscal year 22 to 23, you sent 106 e-consults, which puts you in our Southeast top sender list, but also makes you one of the top 50 e-consult senders for family medicine practitioners across Ontario. So not only excelling in our region, but excelling provincially as well. So very much just want to say congratulations on that before we get started. And keeping all of this in mind, though, and noting that you've been with the service almost since its inception in the Southeast, we'd love to know how you got started with eConsult.
Well, I was thinking of that coming into this call and trying to remember how that happened. Maybe I can get back to you about how we originally got invited. I think that I honestly I can't remember. We were very keen on OTN because we were really wanting to be able to have a platform to do video consults. So we were very sort of aware of that piece. And I think that was how I do some consultation in care of adults with developmental disabilities. And so the video consult at that time, pre-COVID, we didn't even have any kind of mechanism. Was something that was really valuable for me for patients who have really severe challenging behavior and wouldn't be able to come into clinic easily. So to be able to consult in via video to the home. And so that was something we were very keen on. I think maybe we got picked up on eConsult in that mechanism. But I will look and follow up.
No, that's okay. It's a challenging question sometimes, especially when you've been on the service for so long. It's like, oh my goodness, how did I get started? And, when you've been using it in the capacity that you have, it just seems like a part of your everyday practice now. So speaking of that, we would love to know how you're incorporating eConsult into your workflow and practice. So how are you incorporating that into patient visits? And are you experiencing any particular instances where you find an eConsult it raises a flag saying this might be an eConsult or this is how I would like to proceed?
Yeah, I guess actually, sorry, I just thought I'd take a quick sec. So email from David Levin, back, out of Queens in February of 2017. I think we just got emailed by SEMO. And yeah, 6-month eConsult pilot project. We just got emailed by you, Danielle.
Early cohort.
Back at that time. Yeah. No.
2017 seems so long ago now, doesn't it?
It does.
Yeah.
It does.
Yeah.
So we just jumped on at that time. So that there it was. Sorry. So how does it come into the flow? So one thing, and whenever I raise this, I always, I'm so nervous too, because I think I go, oh gosh, this is going to get taken away. But one thing that OTN did early on, which was so helpful, was to make it such that we could delegate access to a administrative assistant. And so my flow with eConsult is that I actually just set up an instant, or like not an instant message, but a simple message within my EMR to my clinic manager. She's very trusted. She's worked with me for a long time. She processes all of my referrals, so not just eConsult. She's like my referral clerk. That's her name, her title, among other things. And so it's very fast. I type it with the patient so that I can make sure that any, bits of information on history or physical exam can be added right then and there. And I also just kind of like them to see, hey, with all the frustrations in the healthcare system, this is something that's really working well. So, then they kind of get to experience this. We're going to type this up. We're going to ask this question right here now. If there's anything that needs to be attached, or a photo, I have a way of just kind of letting my secretary know what that is. So I can say, I have never sent an eConsult myself, and I actually don't know how through the portal. My secretary, my referral clerk has done all of it. And honestly, it helps. It really helps. It's a wonderful thing that was put in place. Now the eConsults come back through hospital report manager, which is great. Like like you see the whole piece right there. That's really nice. But before that was happening, my secretary took the eConsult, turned it into a PDF, scanned it into the EMR, and sent it to me in my inbox with my other things that would say come in the fax, so that there was nothing about my flow that was different from any other consult report coming in. So that's how we've done it, and really hope that we're super excited about Lumeo, or, if I'm saying that right, like the idea of one record. I really hope that kind of capacity to engage our referral clerk administrative assistants that we've put in place is sustained, because it's so helpful to be able to lean on our admin staff to do that.
Yeah, the administrative support, especially in the form of delegates, like you were talking, is definitely something that a lot of providers, especially in our region, that we're aware of leverage. So
Mhm.
it's great to know that you've been doing that from the start, and we hear that it alleviates some of that administrative burden and task that does fall on provider shoulders. So to get that support is fantastic, and we're happy that you're finding that very helpful. I'd also just like to touch on the fact that you're actively involving patients in the e-consult process. So you're doing it with them in the appointment or during your time with them. So, how do you explain eConsult to a patient, and how do you let them know the process moving forward? And you're just one of the first providers we've talked to that's actually done it with the patient present. So we'd like to learn a little bit more about that.
So I will say, we've got this really nice option, in that we can ask for some help from a specialist. Sometimes we're referring as well in person, like we've got that option, or we're e-consulting first and then we're going to refer, or we're just looking at a standalone e-consult is going to be enough. I normally, yeah, so we have this really nice option locally, such that I can get some help from a specialist in whatever. We get a response back within a couple of weeks, versus a consult that could take 12 months, which is probably about average of where we are at these days, depending on the specialist or the specialty and the backlog from COVID. Um, it's essentially a glorified email, is what I tell them, where we can send information confidentially and then we can get a response. When we hear back, we'll let you know what they said. We can sit down and review what they've said and what their treatment suggestions are. And almost unanimously, the patients say, "Wow, that's great. Let's do that." Yeah, so that's how I explain.
Oh, wonderful. And then kind of just building off of that, you're talking about this quick turnaround time for responses. Sometimes you're also doing a referral in the process. Are there any other barriers or facilitators for eConsult that you've experienced, maybe recently or just throughout your whole history using the program, that you would like us to know about, or something that just particularly sticks out in your mind?
There's one little one in that we can't send a video. I'm sure you've heard that as well. Like, and I don't need very long, but from what I know, I had my secretary try and troubleshoot this, I think last year, for a patient with a sort of funny Parkinsonian presentation. And we don't need, like, we so don't need long. Like, there's almost nothing that we're trying to share that's more than 10 seconds. Like, we need very little time, but being able to show video would be super helpful. Neurology probably the most. Tremor, gait. I've even videoed like seizure that I wasn't sure whether it was what we call a pseudo seizure, a non-epileptic seizure. That's generally like a PTSD symptom for a patient versus like a true epileptic seizure. That would be wonderful to have video. Otherwise, honestly, the only barrier would be if we take away the ability to authorize an admin assistant to help. That would really stop me in my tracks, I think. But otherwise, it's working really well. We're accessing folks outside of our catchment region. I'm sure if I had my med admin here, she would have some ideas about like how it's set up in terms of the populating, but I imagine you got lots of rich feedback from other doctors about their struggles there, maybe with, things not auto-populating, if that's an issue. But yeah, no, it works really well. I have a confession to make. I never have had time to go in and do like the rating of whether the eConsult was helpful or not, or provide feedback. So my secretary has authorization to give them 5 out of 5 always, or whatever. So sorry about that. That probably doesn't help with data as you're trying to analyze the program, but I suppose we could change that so that I just send her a message in the EMR with some feedback. I'm going to do that. I'm going to do that as long as I just message her and don't have to go outside of my EMR myself. We could do that.
Well, I will let you know too that there are updates coming to the OTN Hub platform where that survey will be optional. Moving forward, we've collected, since the service has been around for quite some time, a lot of data about the opinions of the service, and the quality of the responses that are being received has been collected. So it is going to be moving to an optional format. So if it's not something that you have the capacity to continue to provide feedback on, not a problem. I will also let you know too that videos are an option for attaching to eConsults. So what I can do is, following this call, I can send you the resource packet for attachments when it comes to eConsults. There's just some specifications on the file size for how it's sent. But yeah, it's definitely something that they can do, and our specialists in those specialties where they become particularly helpful. So for example, movement disorders, pediatrics, they really appreciate getting those photos and videos. So I want to make sure that you're able to supplement those if you need to.
Yeah, no, peds is a good thought. I'd never thought of peds. Yeah, no, that's great.
Yes,
Fantastic.
I
We
will
will
make
do
sure
that.
that you have that for moving forward. So kind of continuing on with our conversation, we've talked a lot about the benefits that you've experienced. But when you're looking at a particular case or patient's circumstances, how are you identifying a potential e-consult? And I ask because we've heard a number of responses from providers telling us they leverage e-consult for a number of things. If they're looking to get advice on how to manage a patient's care until a referral appointment, they're not quite sure if a referral is necessary, or they are just not 100% knowledgeable in a given area and they want that second opinion. So how are you identifying when e-consult is needed?
Yeah, all of the above for sure. So to bridge until the person can be seen, to determine if the referral pathway is even correct, or how to navigate, like which subspecialty within a specialty to refer to. I've done that for like neurosurgery. I'm like, which of you guys does aneurysms? I can't remember, kind of thing. Not like that, worded that way, obviously, but I've done it for full consult. Dermatology is beautiful for that. So fully expecting that I will manage everything based on the advice that I receive. Um, and sometimes I've done it for something that is almost like standard of care. So, I remember really well in residency, one of the general surgeons, mentioning to us, how do you define standard of care? And standard of care has actually got some degree of local definition. So in terms of the resources, what we do, obviously there's, medical guidelines, national guidelines, etc. But there's always some degree of what is actually done at a local level. And so sometimes it's more of a, sort of standard of care. So I just sent one off recently. Patient of mine had an aortic aneurysm repaired. well before she was my patient, 15 years ago, nice and stable post-op, discharged from care, but then actually there was no sort of what is the frequency via which we monitor her for recurrence of aneurysm or new aneurysms. There was a family history that was significant. It was really just a question to Dr. Jakob over eConsult. How what's the standard of care? I can try and estimate that by looking at various different resources, but you're our local person. Like, what should I do in terms of monitoring this person? So that would be like an example of something that's not really a consult, not really a bridge to a referral, but it's more just a clarification
Hmm.
kind of thing.
Well, that's a wonderful example, and I think that's the first time I've heard that shared when we've had these conversations with providers. So, maintaining standard of care, that's an interesting perspective and a great way to use it, I think, especially given the example you provided.
Well, although as I hear that I'm one of the top senders, my first reaction was, oh no, I'm sending too many e-consults. So, that may not have been overly appropriate either. And we don't get the feedback whether we're asking dumb questions or that sort of thing. So, we're open to feedback as well.
Well, I think what we've heard from our specialists is they really welcome the opportunity for an e-consult because in many instances it avoids an unnecessary referral. Right? And they want to be able to provide timely care to patients. And this is a great vehicle for doing that. My follow-up question was, so you get that standard of care or you get a care pathway. What do you do with that information? Obviously, you share that information with your patient, but it might have other applications within your practice. So I'm wondering how you hold on to that information that you've learned from Dr. Jakob in this particular instance.
Yeah, no, I do have a bunch of anonymized or like cut e-consults like pinned up around my desk. So that's one place where I'll put them. But I'm in a little study group. Almost all of us are as family doctors. They're run out of the McMaster problem-based small group learning. And we commonly share e-consult advice with each other that way. I want to really have a
Fascinating.
mechanism to, share broadly, but it'd be really cool, like if we were doing, something from CPD for Queens a half day, and a case they presented was like a real e-consult case, like as opposed to a case they had seen. Just be sort of fun to throw the odd one in there like that, maybe to just share that information because some things exactly like a standard of care. When I've shared them with my study group, they've been really happy to know that information. It was a question they had as well, for example. And yeah, thanks for mentioning the care pathways. Really excited about those pathways that are coming. Hematology has been championing a lot of those out of the Kingston Health Sciences Center around certain conditions. And so I've used eConsult to help with someone who just couldn't fit in the pathway, right? Like they were going down the little arrows the way we needed them to. And so that worked really well. That worked super well. Yeah.
Good.
Fabulous. That's wonderful to hear. Speaking of pathways, it just reminds me of, we have also our gastroenterology department where one of their pathway options is to send an e-consult. And we've developed a whole group on the OTN Hub platform for e-consult just to help with that service at Kingston Health Sciences. So our specialists are very, very much embracing the service. They want primary care to use it, just to speak a little bit more on the feedback. And they love having that opportunity to build a connection with primary care because, as Danielle alluded to earlier, they want to help reduce those wait times. And if primary care can manage a patient in whatever circumstance they're facing, then they want to give that power and that autonomy to the patient and the primary care provider if that's something that they have the capacity to do. So just to give you a little bit of a feedback that's not always shared or vocalized. So just so they welcome the e-consult. So keep sending. And the last question I have for you, Dr. Grier, today is, do you have any advice or recommendations for providers who just might be starting their e-consult journey? So somebody who is new to the service, or maybe a practitioner who's new to practicing. So we support a lot of new graduates and those who are entering the field for the first time. So yeah, any advice or recommendations you might have, some pearls of wisdom to share?
I I I would say, you know, it really like um I think there's a self-selection process for specialists who choose to like it's really nice that you have not made this like every specialist has to do this. Like it's there is that voluntary aspect to it and self-selection because it is a little it's not extending us out of our scope or comfort zone. It's not jeopardizing, you know, patient care from a medical legal issue. Like everything that's done really is upheld. The CPSO would back us up for doing what we're doing. And I think there's been good layers of support and review that way to make sure. Um, but there tends to be that real yeah, just warm, fuzzy feeling, right? Like that real interest in primary care and in supporting family doctors and, you know, helping the patient get care quicker. Just that natural comfort with you've told me you've asked this on history and you've examined this on physical exam. I'm going to assume that this is, you know, not pertinent on history or that you could check that on physical exam. So there's just that real comfort of I can let go of doing this myself and trust that the hands of the GP and the brain of the GP is like managing this. So you know the specialists who self-select and sort of have that, they're just really great to work with, great to ask questions. There seems to be no stupid question, and I'm sure I've asked some, but you know it's a really that would be my advice to someone who's just getting started. You know, you're in warm hands here. You know, you're going to have a warm reception for this. It's going to feel good, and you know, it's going to be helpful for the patients. And then again, you know, if you've got the resources to be able to delegate a referral clerk position within your practice. That's something that I've found helpful. Everyone is different. You know, we're not all the same as family doctors, but certainly in my experience, that's been worth every penny for sure.
Oh, that's fabulous and wonderful to hear. Danielle, do you have any additional questions for Dr. Grier while we have her today?
No, thank you for your participation in the program and being a pioneer and continuing to lead in this space.
Yes, I just want to echo that one more time, Dr. Grier. Thank you so much for your participation. And again, congratulations on being one of our top senders in the Southeast for the past fiscal year. We hope to see your name on that list again. And we very much look forward to sharing all of your insights from today with providers across the region, but across the province as well, because like you said, it's a large community of family medicine, primary care. So I'm very much looking forward to sharing all of that with everybody today.
Oh, thank you, and for the beautiful gifts. Like that was so touching of you guys, and then not needed, but very nice. And likewise, you know, we're really open as family doctors to feedback from the specialists. What can we be doing better on our end? Because we don't want to see this go away. I can't imagine life without eConsult.
Well, I will make sure that when we connect with our specialists, which we do on a frequent basis, make sure that if they do have anything that they would like us to pass on to primary care, that we can get that messaging back to you for sure, because they enjoyed the service as well. So I imagine they don't want to see it go anywhere either. All right. Thank you so much, Dr.
Thank
Grier, and I hope
you.
you have a
Good day.
wonderful rest of the
You
day.
too.